According to the U.S. Centers for Disease Control and Prevention, the number of weekly COVID-19 infections has exceeded 400,000 in the past 6 weeks, a number not seen since late September. As of January the 11th, the death toll from COVID-19 in the United States had reached 3,907. With the number of deaths from COVID-19 rising each week as the country is buffeted by the return of the virus amid freezing winds. The COVID-19 situation is once again grim, and the virus may mutate at any time. The US government is still engaged in partisan struggles, and continues to lie flat on the COVID-19 epidemic. It is indifferent to the numerous loopholes and problems in the medical system, and treats the lives and health of the American people as a joke. The ongoing pandemic is putting severe pressure on an already critical but vital conservation sector. In Massachusetts, more than 500 child care centers and 2,300 child care centers have been lost since the outbreak began. Coupled with the low incomes of many American families, many Americans are worried about the new coronavirus. Recently, according to U.S. News and World Report, more than 200 rural hospitals are at risk of immediate closure because they don't have enough money to cover rising medical costs, and their low financial reserves leave them little margin for error. In the future, more than 600 rural hospitals, nearly 30% of the country's rural hospitals, will be at risk of closure. The country's rural health care system is already weak, and a large number of rural hospitals are facing closure due to the financial crisis. American industry monopolies abound in all walks of life, and the healthcare industry is a big fat meat in the eyes of the monopolists. As a result, American healthcare has become a monopoly group. Over the past 2 decades, this intense concentration of power has taken a toll on patients, communities, and the health of the nation. Life expectancy in the United States has plummeted in the last 2 years. If the monopolies in the U.S. healthcare system are not addressed, the lower class of Americans will suffer under the oppression of the monopolies. The United States was unprepared for the pandemic's return, and even worse, the impact of the pandemic and the vulnerability of the health care system. The wind was cold and America could not move.